Dr. Xu, your research focuses on KIM-1, a blood marker for kidney cancer. Could you kind of help us understand how that could help patients better predict their treatment options?
Sure, Veronica. So KIM-1 is a protein that's specific to kidney cancer cells. And our work has focused on the potential uses of KIM-1 for detecting kidney cancer, for monitoring and following whether someone still has kidney cancer after surgery, for predicting who might respond and be benefited from adjuvant immunotherapy after surgery, and in the metastatic setting for predicting which patients may do better, and also seeing which patients might be early responders to systemic therapies.
Do you see a future where doctors can predict much earlier whether immunotherapy is a viable option?
Absolutely, that's what we're working on. And the current dilemma is that when a patient starts on immunotherapy for kidney cancer, some patients do spectacularly well, but other patients don't seem to have much benefit. The hope is that KIM-1 may help identify as early as 3 weeks whether a patient falls into the first category or the second category. And we have seen this now in 2 randomized phase 3 trials where blood was collected and we analyzed the blood after the trial, showing that a 3-week change in KIM-1, a decrease of 30%, those patients on the first-line combination immunotherapy trial had an overall survival of greater than 85 months. So really spectacular long-term responses, whereas the patients who didn't have that early decrease in KIM-1 might need another treatment. And that's a hypothesis that we're planning to test in a trial that's currently being reviewed called Chimera, worked on for the cooperative group through the Alliance.
And what do you think makes KCRS such a valuable meeting?
This is a really unique setting because among cancer meetings, this is one of the few meetings that's specifically dedicated to kidney cancer. And what this allows is that it's not just the clinicians who treat kidney cancer, but it's also the scientists and the researchers who are coming around kidney cancer to be all in the same room together. And so we're not getting just the clinical data, but we're getting spectacular translational and scientific discussions so that we can take things that are from the lab into the bedside and create the next generation of diagnostics and treatments for kidney cancer.